Beta Benefits Insurance Services enjoys serving doctors in Southern California with any business or personal insurance needs. From patient medical plan education and retention programs to assisting workers with compensation and liability coverage, Beta Benefits provides comprehensive solutions for physicians. We help doctors with patient retention through a Medicare education process to help patients as they age into Medicare. Our Medicare 101 program can be accessed on YouTube or at our website, www.turning65seminar.com. Our trademarked Medicare education presentation covers the basics of Medicare and is offered in person at many Southern California locations monthly. Our patient enrollment support is available as well. We coordinate with you to make sure the medical plans you are contracted with are the plans we offer your patients. From Medicare to Covered California and individual plans, our team of certified and seasoned professionals work to find the best medical plans available for patients. Since Beta Benefits was established in 1993, we have assisted thousands of patients to stay with their doctors. Today, the agency is housed in the historic Mintner House in downtown Santa Ana. Beta Benefits provides insurance solutions for Medicare, small employer groups, and individuals. While most of our clients work with Beta Benefits for health and medical plans, small businesses also access workers' comp and liability coverage through Beta Benefits. We work closely with doctors throughout California to help their office staff and patients understand the complexities of the Affordable Care Act. We specialize in Medicare plans and the GAP plan. This presentation covers the GAP plan, which is offered as a solution for clients concerned about the rising cost of insurance and deductibles. We love how the GAP plan saves patients thousands and hope you'll find GAP a fit for your patients. This presentation will explain how doctors can use a two-step program to gain a significant savings in insurance premiums for their employee health benefits. The two-step savings starts with tax credits when paying group medical premiums for employees. Most doctors qualify for tax credits as high as 50% of the premium paid for employee medical. These credits are only available through a program called SHOP, or Small Business Health Options Program. SHOP includes Blue Shield or Health Net for small businesses. HMO or PPO plans are also available in SHOP. Many doctors and office managers ask us if the medical plan benefits or premiums for Health Net or Blue Shield are the same through SHOP as going direct to Blue Shield or Health Net. The answer is that SHOP plan premiums and benefits are the same. So with plan benefits and premiums the same with SHOP and tax credits only available through SHOP, it makes the decision to move to SHOP less complicated. Tax credits often add up to thousands of dollars, making SHOP a serious option. Tax credits can be as high as 50% of the premiums paid for employee medical. A recent example is a doctor we helped who has 6 employees on Health Net. The medical plan annual premium totaled $15,000. We moved the doctor to SHOP, and he earned a tax credit of 50%, so the doctor qualified for a tax credit of $7,500. His employees stayed on Health Net PPO plans and had no change in doctor or hospital access. The other program we use in combination with SHOP is called the GAP plan. The GAP plan is a secondary insurance policy which covers the financial gaps in a primary medical plan. People use the GAP plan alone or with SHOP. The GAP plan covers the primary medical plan deductibles and co-insurance amounts which exist in most PPO plans and in many HMO plans. The GAP plan works with any primary medical plan that has a deductible and can be used to also cover co-insurance costs. You will see in this presentation how the GAP plan works when one either has a medical plan through their employer or through an individual plan with a deductible. Either way, the GAP plan could help save thousands. We like to think of the GAP plan as a financial protection tool that takes the risk out of a primary medical plan. In our doctor example, with a tax credit of $7,500, the doctor was able to select a lower premium medical plan in SHOP, a silver plan, and add the GAP plan to cover the silver plan deductible and out-of-pocket maximum. The result was a benefit package that was as rich as one can find, even better than a platinum plan, but at a fraction of the premium of the platinum plan. In our doctor's case, the employees were very pleased with the benefits, and they all moved from an HMO to a PPO with the SHOP program, which gives them access to more doctors and hospitals. Let's look more closely at how the GAP plan works. Nearly anyone with a PPO plan will have a deductible that must be covered. We are also seeing a change in the HMO plans, where many of the new metal HMO plans have deductibles and co-insurance. All metal plans, from bronze, silver, gold, and platinum, have out-of-pocket maximums. Bronze, silver, and gold plans usually have deductibles, so the GAP plan fits most of the metal plans. The GAP plan can be purchased two ways. First, GAP can be purchased on an individual basis, or GAP can be offered by an employer to employees. The Solutions GAP is the group-based plan, and MediBridge is the individual program. MediBridge is used by individuals to cover the growing financial risk that rising deductibles create. Premiums can be less than $50 a month and cover thousands in deductibles and co-insurance. Because of how the GAP plan works, many doctors have encouraged patients to look into the GAP plan. Nearly anyone with a PPO plan will have a deductible that must be covered. The GAP plan can cover non-urgent, in- or outpatient medical care. The GAP plan works in combination with either a medical plan through an employer or a plan purchased as an individual. Either way, the GAP plan could help save thousands. We like to think of the GAP plan as a financial protection tool that takes the risk out of a primary medical plan. The GAP plan includes two key coverage components. Most people try to match their GAP plan coverage to fit over their primary medical plan. The benefit amount selected is the maximum reimbursement payable when a medical claim is filed. We assist our clients to select the amount of coverage they need. The first type of coverage on the GAP plan focuses on expenses while admitted to a hospital as an inpatient. While in the hospital, any bills from the hospital or your doctors that fall into the deductible or co-insurance for a primary medical plan and would be covered by the GAP plan. The second type of coverage includes benefits for outpatient services. Outpatient services range from diagnostic tests to surgeries which do not require an inpatient hospital stay. The outpatient coverage on the GAP includes 4 conditions per calendar year. The outpatient benefit amount purchased can be applied to each condition. A condition is a unique medical diagnosis, such as giving birth to a baby. Another example is a knee surgery. These 2 conditions are totally unrelated medically. Even if during pregnancy the mom hurts her knee, these are still 2 unique conditions. The GAP plan would cover up to the benefit amount purchased for each of these conditions. If you purchased $1,000 out of patient coverage, you would be able to get reimbursed up to $1,000 per condition. So in this case, up to $1,000 maximum reimbursement is available for outpatient care provided to mom while pregnant, and up to another $1,000 for the knee surgery. The GAP plan is a secondary plan that covers the gaps in a primary medical plan. The GAP plan is designed to cover the deductibles and co-insurance amounts not covered by the primary medical plan. With deductibles and out-of-pocket maximums rising every year, you must pay these rising costs out of your savings. With the GAP plan, you'll save money compared to having no secondary policy. Remember, all medical plans pay 100% of medical costs when you reach your calendar year out-of-pocket maximum. The question is, who will pay the deductible and out-of-pocket maximum every year? With the GAP plan covering most of your medical costs before you meet your out-of-pocket maximum on your primary medical plan, you reduce your financial responsibility from thousands to a few dollars for a small premium for the GAP plan. Imagine the hospital cost of having a baby. If a plan's out-of-pocket maximum is $4,000 and a GAP plan is added to cover the full $4,000, in this case, the person would keep the difference between the GAP premium and the $4,000. For someone age 30, the GAP plan premium would be $30 a month or $360 a year. Do you think the savings of $3,640 would go a long way to buy items for a new baby? We have seen how doctors can use the GAP plan and the tax credits available from SHOP to save thousands on their employee medical benefits. Doctors can offer the GAP plan only to employees. If at least 2 employees sign up for GAP, the plan can be offered as a group plan. The doctor and 1 employee or 2 employees, either way, you can start with 2 signing up and get a price break over the individual GAP plan rate. GAP is available to individuals with a primary medical plan, so any patients with a PPO and many with an HMO can use the GAP plan to cover their deductibles. If your patient needs an expensive test or procedure that is not urgent, they can qualify for the GAP plan within 30 days or less in most cases. Doctors who perform in-office diagnostic testing or minor surgery can avoid the typical write-offs that seem to happen with patients facing a medical need but a financial challenge due to a high-deductible plan. We have handouts you can use for patients, and we can quote your employees if you provide us with a list of ages and coverage amounts you think will work with their primary medical plan. The next step is to get started. Email your employees' names and ages to info@betabenefits.com. For patients, we can quote over the phone or email quotes. We can also provide rate sheets and assist people over the phone with selecting the coverage amount they need. Call today, 800-500-9799, extension 226, with questions.